Hi everybody, Wayne Klug here with Spectrum Technology Solutions. As you probably know by now, it's October Cybersecurity Awareness Month. We're almost at the end of it. And I'm not here today to talk to you about another tip or a mythbuster, but actually to talk to you about a real cybersecurity threat that is occurring in the United States against healthcare practices right now. So pretty serious topic. There was an advisory issued just yesterday, a joint cybersecurity advisory issued by the Cybersecurity and Infrastructure Security Agency, CISA, the FBI, and the Department of Health and Human Services. And the advisory is saying that there's a cyber criminal group that is targeting the healthcare and public health sector to infect systems with what's called the TrickBot malware. The TrickBot malware, once installed on a system, provides a whole suite of services for cyber criminals to perform illegal activities, things including like mail exfiltration, crypto mining, POS or point of sale data exfiltration, the deployment of ransomware, and other various things. But the big thing that we're seeing with this particular attack is the deployment of what's called the Ryuk Ransomware, and it's for financial gain as the reason for the cyber criminals doing this. So I took some notes. I read through the advisory guide. I'll post it in the comments below this video, but I just wanted to summarize the high points here, or the key points that might be relevant for those of you that operate medical practices or that are in the healthcare industry. So the advisory is saying there's credible information of a serious and increased imminent threat against healthcare providers and hospitals in the United States. And the warning is going out to healthcare providers to help take precautions to protect their network from the threats that are imminent here. So what's happening is with this TrickBot malware, it enables 156 techniques and 272 sub-techniques for a cyber criminal to be able to perform different tactics and compromise the network. What we're seeing is with this particular attack that there's 13 techniques that we can tell right now are being deployed. And really what's happening is once a system gets infected with this malware, these cyber criminals are pretty smart. The Ryuk actors are working to stay under the radar, so to speak, and not be picked up by us IT pros, or try not to be picked up by IT pros as something unusual on the network. So once they get into a system, they're doing really common things that IT professionals would be doing. For example, they're running PowerShell commands. They're checking things in WMI or Windows Management Instrumentation on a server system. They're using Remote Desktop Protocol, RDP. All these things that are sort of common for us to use on a day-to-day basis as IT professionals and even as end users of a computer system. So the reality is these guys are sometimes lingering on servers for some time, and they're just waiting for the critical moment or a moment where you might be most vulnerable to execute, so that they can command the highest kind of premium in terms of the ransom that they're going to charge. So right now, obviously, we're in a bit of a troubling time in our healthcare system where COVID cases are on the rise. Hospitals are starting to fill up with infected patients. And so it's, really a terrible, terrible time. Not that there ever is a good time, but it's even a worse time than normal, I think, for a cyber criminal to execute attack against our healthcare system. So something to take very seriously as our nation's at risk. So that said, there are some things we can do to help mitigate this attack. And I don't want this to just be doom and gloom, but I want to offer some really practical things that we can do as business people and IT people to help prevent this. So the advisory guide lists out 11 things, very specific, that could be done on a network. I'm going to just touch on the high points, and you can read through the rest here in the link that I post below. But first, before we go through this, I want to just really make sure that it's clear that it's 100%. It's not possible to 100% prevent a ransomware or cyber attack. Anybody that tells you that they can guarantee you'll never have an attack, you shouldn't trust them. It's just these things are rapidly evolving. They're complex. They emerge so quickly and get modified so quickly that it's just impossible for any set of measures to totally prevent that. That said, we can definitely reduce the likelihood of it, and that's what we're after doing. So we should always make sure we have a really strong and well thought through business continuity plan, so that if these criminals can get past all the defenses we have, we know exactly what to do, and we're able to have a clear plan that out and think about that plan at a time where we're not pressured, and be able to have a solid plan that we can enact that allows us to operationally continue serving patients and continue working to the best of our abilities in the event of a disaster. So make sure if you got a business continuity plan that it's understood by your key team members, by your executive team and management team. If you don't have one, you better get started making one, because you definitely want to have that ready and thought through before you need it. Aside from that, some real practical steps that we can take from an IT standpoint, things like making sure your operating system, your firmware, and your software systems for your practice management software and such are all kept up to date, and that you don't have any holes in your security in your software. Making sure that passwords are being changed often, that people aren't reusing passwords across different systems is important. Any of the systems that you can have multi-factor authentication or two-factor authentication enabled on, that should be set up. That's a great defense against cyber criminals. Disable remote access or RDP whenever it's not necessary for business. Make sure that you're scanning for open listening ports on servers or on firewalls to make sure that you don't have unnecessary holes open. Make sure that you've got auditing in place for user accounts that are being created. Sometimes cyber criminals will get in through some hole and then they'll start creating backdoors and different administrative accounts that they'll later be able to use to cause damage. And so you should have auditing in place, or consider having auditing in place to catch new admin accounts that are being created on the network. Make sure that you've got backups of all your critical systems and that you've got those backups kept offline. Or you've got some set of it at least kept offline. And what that means is if all you're doing is backing up to an external hard drive and you get a ransomware attack, you're going to have your backups encrypted as well, along with all your live data. So you got to have a cloud or offsite backup in place separate from your primary network so that you've got something that's not compromised. Make sure you have a solid antivirus, anti-malware, anti-ransomware system, preferably something that's backed by a 24/7 Security Operations Center or SOC. And make sure you have really good, solid cybersecurity training. I mean, all these, the reality is, guys, these attacks come in oftentimes through email, through phishing, targeted phishing emails. And so it's really important that your end users know what a ransomware attack is, how cyber criminals operate, at least generally, and what to look out for in a phishing attack so that they can stop it before it starts. I want to just point out one last thing, and there's more things here. Make sure you take a look, but I want to really make sure it's clear the CISA, the FBI, the HHS do not recommend paying any ransom. And in fact, these cyber criminals or cyber criminal organizations have recently been classified as terrorists. And so if you send a ransom to these folks, it could be considered aiding and abetting a terrorist organization. So something to take very seriously. The good thing is, guys, if you got a good solid backup with enough retention, you're never going to need to pay that ransom. So make sure you got that in place. Hopefully this is helpful for you. If you're a current customer of ours and in the healthcare industry, within the next 24 hours, we'll be reaching out to you to let you know some key elements of your system, where we're at with those things, to make sure that you're protected as best we can against this threat. If you're not a client of ours, whether you're in the healthcare industry or not, and you want some help with your security posture, your technology systems, you have concerns about whether you're being taken care of well or if your systems are secure, please feel free to reach out. We're happy to help you get through this and develop a stronger security posture going forward. So again, hopefully this is helpful. Thanks for listening, guys, and talk to you soon. Thanks. Bye.